Greetings and salutations, folks. Many thanks for joining me again. This time, I am going to discuss an issue that is near and dear to my heart since I've had so much experience with it over the past couple of years, namely healthcare reform in the United States. Specifically, plans for repealing and replacing the Affordable Care Act, better known as Obamacare, that are currently on the table in Congress. Discussing this issue with me today is my friend Charlie Katebi.
How's it going?
Good. Now, Charles is a policy fellow at the Millennial Policy Center, yes?
Yes, that's right.
He is something of a healthcare policy wonk, looking at American healthcare from a free market-oriented perspective, which is a perspective that, contrary to what some might think, actually doesn't get anywhere near enough exposure in the discourse surrounding healthcare reform. Charles is going to help us out a little bit with that. So just for starters, Charles, why don't you tell us a bit about your personal and professional background and how you came to do the work that you're doing today?
Sure. So I grew up in Massachusetts. I went to school studying economics and political science at the University of British Columbia, the same country where you hail from. And after that, I interned at a few think tanks in Washington, D.C., FreedomWorks, the American Action Forum, the Reason Foundation. And from there, I went to Wyoming to work on a number of healthcare policy proposals, particularly Obamacare's Medicaid expansion and why states shouldn't expand that program. Now I'm working at the Millennial Policy Center, and primarily we're working on healthcare policies and proposals that will benefit millennials because we feel that millennials weren't getting their interests represented very much in the healthcare debate these days, and we wanted to change that.
What is your take on the competing proposals for repealing and replacing Obamacare that we're hearing coming out of Congress today?
There are a few good ones. The biggest one that everyone is talking about that has the most chance of passing is the American Health Care Act. This is the one that Paul Ryan put forward. There are some good things about it. The biggest thing I do not like about it is it doesn't reform the biggest driver of out-of-control healthcare costs, and this is the tax exclusion for employer-sponsored insurance. Now, this is a little wonky, but this is the biggest tax deduction the federal government doles out. It basically reimburses companies that provide health insurance benefits. And if you reimburse their premiums, they're going to be providing coverage that's very comprehensive and doesn't encourage patients and their workers to care about how much their healthcare costs because the deductibles are very low. There was a proposal in a leaked draft that Politico put out, but people lost their minds over that. A lot of employers don't like the idea that they would have to pay for those costs and not have the federal government pick them up. So for some reason, mysteriously, that part of the bill was left out. And there's no reform absolutely to the employer-sponsored market, which is a big problem, in my opinion.
Right, yes. I've definitely heard a lot about the problems with American healthcare stemming from the whole system of employer-based health insurance, which dates back to the Second World War, which I've really always had a problem with, not only practically, but in principle. I actually don't think that it's the job of people's employers to make sure that they get whatever assistance they may need in affording health insurance coverage. I think that other institutions in society probably should shoulder that burden more. How realistic do you think it is that any healthcare reform in America would actually include reform of that foundation of the American healthcare system? You yourself just told us about that little bit of political skullduggery because of the political unpopularity of the idea of getting rid of that tax exemption. So you think there's any hope for making that reform?
I'm not putting it very high in terms of the chances of it passing, particularly because a lot of the public complaints about this bill don't include that. The conservatives, ones like Rand Paul, and the conservative groups like FreedomWorks, Heritage Action, the Club for Growth, they're not talking about reforming that part of our system. They're talking about the fact that it includes refundable tax credits, which would come up with a new government program to fund healthcare. They're talking about how it doesn't expand health savings accounts that much. They're not talking about this major driver of our healthcare system. It doesn't sound like it's going to be put into any final reform because nobody's talking about it. And I don't think most people in Congress want to reform this system. It provides a lot of benefits to a lot of powerful interests in the health insurance system.
That's right. And it's been so deeply entrenched for so long at this point. I'm sure most Americans could scarcely imagine a system in which they don't mostly get their health insurance coverage from work. So that's definitely a tall order. But in addition to the principled objection that I just mentioned earlier, there are a lot of other practical problems involved with employer-provided health insurance, such as the fact that if you lose your job, within a matter of months at most, you lose your coverage. that
Yeah.
can make the labor market tighter than it otherwise would be or than it should be. It gives people extra stress that they have to face in the event that they fall out of work, et cetera, et cetera. I mean, the list goes on. And of course, it also leads to a great many political controversies, like the whole controversy over whether religious employers should be forced to cover birth control in their policy.
Yeah, all these things are really packed in. And you made a very good point that people can't really wrap their minds around a system outside of it, because around 150 million Americans, employees and their dependents, all rely on this system. And when you tell people what would the alternative be, you tell them it would be the individual market. Well, have you seen the individual market? It's an absolute disaster right now. There are too few people inside. The few people that are in are sicker people, and healthy people aren't getting in. So the premiums are very high and the choices are very few. And granted, a lot of those problems have to do with the ACA, but these problems with the individual market preceded the ACA. And it's very hard to explain how this system could be made better. But you make a very good point about the fact that employer-sponsored insurance isn't really insurance, because if you get sick and you get something terminal that takes you out of the workforce, you lose that insurance, and you lose it at exactly the point when you need it, when you develop a really catastrophic condition. So we really need to hammer home the point that employer-sponsored insurance, one, is very expensive, and two, that it doesn't deliver the benefits that people claim that it does.
So in that case, what would be, at least in principle, the best alternative? Would you envision a system in which people generally, wherever possible, buy their own health insurance coverage directly without having their employers inserted in between as a middleman?
Yeah.
And maybe those who need assistance in affording the premiums can get that assistance in the form of subsidies. To be honest, I'm sympathetic to that approach. Do you think that that would be viable, or what would be your vision for ideal healthcare reform in America?
I like to keep an open mind with all ideas, but what you basically said is basically the general framework of where health insurance needs to go, where people are paying their own premiums, are absorbing those costs, where they can shop and see what are the health plans available, what do they cover, and then they make those trade-offs for themselves. And when people purchase healthcare for themselves, they care about not just the quality of the care, but they also care about how much it costs. And that's what a functional health insurance system needs to be. You need a health insurance system where people care about how much it costs. And when that happens, then providers and sellers will start providing things that are cost effective and cost conscious. A lot of providers right now, like physicians, they're ditching their administrative back office that would normally deal with insurance. And instead, they're offering to provide their primary care on a monthly basis, sort of like a gym membership. That's called direct primary care. So when people start using health savings accounts, start using the individual health insurance market, hospitals and doctors will start coming up with these new ways and better ways to provide health care that's a lot more affordable for a lot more people.
My understanding is that one of the features of the Affordable Care Act of Obamacare is the provision of subsidies by government to help people purchase health insurance through the exchanges and so on. If I'm not mistaken, you're an opponent of Obamacare, are you not?
I am, yes. There are quite a few problems with that bill, to say the least.
How would you sum up, in a nutshell, the major problems with the Affordable Care Act, even in light of the fact that it does offer those subsidies?
The main problem with the ACA is it doesn't make health insurance affordable because it tries to short circuit the health insurance system. And with any health insurance, whether it's car insurance, health insurance, or life insurance, you need enough low-cost people paying premiums to pay the bills of the few people, hopefully, that will be drawing down on those benefits. What the ACA does is it makes insurance very unattractive for healthy people and young people. And if you do that, they won't buy your insurance. And that's what happens. They made insurance very comprehensive and very expensive, and they did subsidize it. But if you make it very expensive and very comprehensive, the only people that makes sense for are very, very sick people. A lot of sick people came on. Not a lot of young and healthy people came in, and this is why insurers are losing billions of dollars across the country selling these plans, and this is why you're seeing insurers leave the insurance market. One interesting factoid to note is that there are now 16 counties in Tennessee that will have no health insurers in their district if nobody comes in 2018. And that's because Humana left, because they were losing so much money. So this is what happens. The health insurance system just disappears if there are only people drawing down benefits and nobody is paying in.
But wasn't that the whole purpose of the individual mandate in Obamacare, to force a lot of relatively young and healthy people to join insurance pools and pay in to make it more affordable for the whole pool?
You're absolutely right. The individual mandate, though, is not a legal requirement that you have to buy insurance. It's a tax. It's a penalty. This year, it's about $700. But the thing is that the average cost of insurance, only the premiums, this isn't talking about the deductibles or the co-payments, is $3,600. So most young people saw a $3,600 health insurance plan, and they saw a $700 penalty, and they decided to pay the penalty. And that's frankly what I did as well. It simply doesn't make any sense to purchase that type of insurance policy, particularly if you're not getting any subsidies as well.
Would you say that the individual mandate is not actually achieving its stated objective because
it's not enough?
Steep enough? And in that case, couldn't it be argued that the solution to the problem is simply to make the penalty harsher so that it will give people a stronger incentive to buy insurance?
If your mere goal is to push people into the market, Switzerland actually has an individual mandate that says, I believe, as soon as you move to Switzerland, within 3 months, you must buy insurance under penalty of imprisonment. And to be fair, some liberals, and author in Mother Jones, actually made the case that the simple solution is merely to raise the penalty so much that you are forcing more young people into the individual market. I think that is short-sighted, to say the least, in terms of a healthcare solution.
But why is it short-sighted? I mean, I can see how it's not politically popular because it's so unpalatable to the people who will actually have the proverbial gun put to their heads and forced to buy insurance against their will. But as a matter of public policy, why is it not a viable option?
So the ACA and most healthcare policymakers, their general framework for healthcare is how to better the lives of people that cannot afford insurance, particularly low-income people. If you force them to buy a $3,600 policy, they might not have money for rent. They might not have money for food. So you're basically forcing them to buy a product at the expense of all their other personal needs. And this is the problem with most of America's welfare system. We try to push people into certain things when, to be honest, they have their own individual needs. A low-income person might need health insurance, but then again, another person is healthy and might be better served getting assistance to go to a community college. We dot all of these different personal needs, but our public policy towards low-income people doesn't reflect that.
Couldn't that problem be solved just by making the subsidies more generous?
No, you're absolutely right. But here's the problem with that. That money has to come from somewhere. And it has to come from taxing people. And usually it also has to come from taking money from other benefit programs. One big problem with Medicaid is that as it grows to cover more people, states actually have to cut back on other services they provide. Mercatus Center did an excellent paper where they show that as Medicaid's costs have increased as a share of their budget, they're diverting less funding towards public education, like public colleges, and they're diverting less money towards primary and secondary education. So these aren't free lunch decisions. These have very real consequences for a lot of people.
I'm glad you brought up Medicaid, actually, because that's one whole controversy unto itself within the larger controversy about healthcare reform. I actually have experience being a Medicaid beneficiary because for the first of the couple of years that I was living in Washington, D.C., I actually was on Medicaid because I was assaulted on the Washington, D.C. subway right when my law school insurance plan expired. And while I was in there, a representative from the hospital met with me in my hospital room, asked if I had insurance. I told her my plan had just expired. She said, here are the instructions for applying for Medicaid coverage. And I said, I'm Canadian. I'm only here on a temporary work permit. Am I eligible? And she said, actually, in DC, you are. So I got the coverage for a year, and that's how I got health insurance coverage for the first year that I was in DC. So I actually have experience with the value of having that coverage as opposed to not being covered at all. But I also hear that statistically, Medicaid doesn't show very impressive results in terms of the healthcare outcomes that its beneficiaries enjoy. One theory for that is that a lot of healthcare providers don't accept Medicaid patients because the reimbursement rates are so low. My question about that is, a lot of free market advocates or opponents of Obamacare like to point that out as an argument against Medicaid expansion. But my response to that is, isn't that just because Uncle Sam doesn't spend enough money on Medicaid? And couldn't that problem be solved by funding the program more generously, maybe financed by higher taxation on the wealthy or whatever, so that the reimbursement rates will be higher so that more doctors will be willing to cover Medicaid patients? What's your answer to that argument?
That's certainly an argument that has been made for that, in that Medicaid has very low reimbursement rates. Therefore, we should subsidize it more. The problem is that that will beget more Medicaid spending because it's an open-ended program. There is no limit on who can join the program.
Other than income. I mean, obviously, it's a means-tested program, right?
Oh, no, you're absolutely right. I meant on the numerical quantity of people that can join the program.
Right, okay, there you go.
The problem is that as we pour more money into Medicaid, the program continues to grow. So it never seems like that system is solved. There is a way, however, actually to do that, to actually make sure that low-income people who can't afford coverage can get coverage. And it's more straightforward than Medicaid. And it's providing a refundable tax credit or some form of subsidy for people to get private insurance. And therefore, you get out of this problem where Medicaid continues to grow. And because it grows so much to more numbers of people, it has to reduce its reimbursements. And there is a way to fix that. You just provide the subsidies directly to individuals and allow them to purchase their own private insurance, just like with school choice. You want people to be able to decide what sort of school they want to go to because everyone has different education needs. For people that can't afford insurance, I think it would be an excellent idea to provide people below a certain income level some sort of fixed refundable tax credit to pick their own health insurance in a much more deregulated private insurance market, far more than what we have right now.
I agree with you on that. And again, as someone who's been on Medicaid, I can tell you, while having a plan provided to me definitely took certain headaches off the table for me, I definitely would also have appreciated the opportunity to get a subsidy and make my own choice of health insurance plans. If I could have gotten a plan that would have enabled me to get coverage to be treated at maybe a higher quality facility, the problem that I've had with my knee, with the first knee surgery I had, I don't know how much you heard about that, but I had a knee surgery that went horribly wrong, and I'm still dealing with the consequences of that to this day. I might have been able to avoid that if I hadn't gone with that facility on that Medicaid-based health insurance plan. Just a couple more questions. The trillion-dollar question, especially for someone like me who grew up in Canada on single-payer healthcare. What argument would you make to people who are not philosophically libertarian or pro-free market like you and I are for not going down the Canadian or British path? Why not just adopt single-payer healthcare, which on some level might be simpler and more streamlined than the healthcare status quo in the US? It would cover everyone. I can personally attest that the functioning of the system is not as disastrous as free market advocates often make it out to be in the United States. And of course, there's a lot of value in knowing that you won't, in all likelihood, go bankrupt because of healthcare bills and so on. I can personally attest, having gotten my knee replaced here in Canada, that there's a lot of value to that. So in a nutshell, how would you sum up the case that the United States should not adopt single-payer healthcare?
The practical response to that is the same response I gave to you on Medicaid, in that you don't have those same choices. The main problem is that that is healthcare coverage, not healthcare access. You may have a right to walk into a doctor's office, but they may have tons of people that are already waiting for that healthcare. And so that means that you have to wait longer than you otherwise would in the United States. And it's the same problem with Medicaid. You may have a Medicaid card, but that is no guarantee that a doctor or a hospital will see you. And so the main practical response I would give is that health coverage does not equal access, and people suffer for that. Every year, the Fraser Institute in Canada puts out a big report that's called Wait Your Turn. And they track by region in Canada the wait times for a variety of different medical procedures. And they've doubled. People could wait weeks or months for certain surgeries. And that has real health consequences, especially if you have something like cancer, which needs a timely medical response.
I can attest to that through personal experience, again, with my knee injury, because when I came back to Montreal from DC 2 years ago, I went to see my old doctors who had followed me for years up here, told them about what happened to my knees. They referred me to an orthopedic surgeon whom it took, I think, 2 or 3 months for him even just to see me. And then when he saw me, he said, yes, you're going to need your knee replaced. But then he couldn't do it himself, so he had to refer me to another surgeon. No, sorry, it took me 1 month to see him. It took me another 2 months to see the other surgeon to whom he referred me. And then they put me on a 4 to 6 month wait list. And the wait actually took 7 months. And in that intervening time, I became heavily dependent on the painkillers that I'd been taking since I was in DC. And the doctors in the meantime had to keep ratcheting up the doses. And lo and behold, I ended up with a chemical dependency that I'm now still working to wean myself off of with the help of another doctor. I was lucky because I was young and seriously injured, walking around on a cane, dependent on these drugs. If I had been your average or typical knee replacement candidate, someone in my grandparents' age, if that had been the case, I've actually had a receptionist at our family doctor's office tell me this bluntly. They would have just scheduled me for a year later on. If I had called in May 2016 to say I need my knee replaced, they would have scheduled me for May or June 2017. That's just the way it works. So you're quite right that the wait lists are real. Sometimes they're overstated, but they are real, and that's a real cost involved, which is why I don't think myself that the U.S. should adopt single-payer healthcare. I think there are other ways to bring about universal coverage and to make healthcare affordable. Frankly, from what I've read, it seems the countries that have the best overall healthcare outcomes are actually not the countries with single-payer systems like Canada or the U.K. They tend to be countries in continental Europe and East Asia that have more of a mix of public and private delivery and coverage. That's the kind of route that I think the U.S. would be wiser to take. In a nutshell, is there any particular plan that's on the table right now in Congress that you think would be optimal for Congress to pass and for President Trump to sign into law?
There is a couple that I really like, except for one crucial thing. Rand Paul and the Republican Study Committee have both put out two excellent plans that would repeal the ACA, roll back Medicaid expansion, deregulate the health insurance market, and allow people to choose much less expensive health insurance options. The one thing I don't like is that they make their tax deductions for health insurance non-refundable, which makes them pretty much useless if you're somebody who can't afford insurance, who are low-income people. That's the one thing. If there was a way to pair those really free market reforms with a refundable tax credit, which will allow low-income people to buy more affordable insurance, I would sign on to that. But that is one of the big sticking points. A lot of the conservative members of Congress, as well as the really conservative advocacy groups, hate the idea of people receiving checks in the mail to purchase health insurance. That is going to be one big sticking point that has to be resolved before we come to a solution here.
Okay, well, that's all the time I and you have for this particular conversation, but obviously, contrary to what the new president remarked in one of his recent speeches, I know I've always realized how complicated the healthcare issue is.
What are you talking about? Yeah.
I don't know where Trump was coming from saying, who knew healthcare could be so complicated? But anyway, the reason I bring that up is because I'm sure I'm going to want to follow up on this conversation with you in the future. I guarantee you when I share this on Facebook, a lot of my left of center friends are going to have a lot of criticisms of it, but we're connected on Facebook, so obviously you'll be able to defend your proposals in that conversation. And I look forward to having future conversations with you on this and related topics. Thanks so much for joining me, Charlie.
Yeah, thank you.